Demystifying NCLEX cardiac clinical concepts. Understanding essential cardiology topics. The heart, an emblem of vitality and resilience, stands as an unparalleled wonder within the human body. Its intricate orchestration of beats serves as the lifeline, propelling blood throughout the body. In delving deeper into the cardiac clinical domain, an intricate tapestry of knowledge unfolds, offering insights into not only the anatomical complexities but also the profound clinical implications across healthcare disciplines, notably within nursing practices and the NCLEX examination. Significance of cardiac clinical knowledge in nursing practice. Nursing, a profession rooted in compassionate care and clinical expertise, finds its cornerstone in understanding cardiac clinical knowledge. Comprehending the complexities of the heart and its ailments is pivotal for nursing practitioners, given the ubiquity of cardiovascular disorders in healthcare settings. The discernment of these cardiac clinical concepts elevates the caliber of care rendered, allowing for astute assessments, precise interventions, and informed patient education. Overview of cardiology's relevance in NCLEX preparation. The National Council Licensure Examination, NCLEX, stands as a litmus test for aspiring nurses, assessing their competency and readiness for professional practice. Cardiology, an integral facet of this evaluative benchmark, demands a comprehensive understanding of various cardiac clinical nuances, ranging from anatomy and physiology to diagnostic procedures and emergency response protocols. Cardiac anatomy and physiology. In-depth exploration of heart structure and function. The heart, an organ sculpted with precision, comprises four chambers, the atria and ventricles, each meticulously designed to facilitate the orchestrated dance of blood circulation. Understanding its structural intricacies elucidates its functional prowess, wherein rhythmic contractions enable systemic and pulmonary circulation. Comprehensive understanding of circulatory system dynamics. The circulatory system, akin to a labyrinthine network of arteries, veins, and capillaries, forms the conduit for oxygen and nutrient delivery to tissues. Grasping the dynamic interactions within this system unveils the mechanisms underlying numerous cardiovascular maladies. Impact of age on cardiac anatomy and physiology. Age, an immutable factor shaping bodily functions, leaves an indelible mark on cardiac anatomy and physiology. Appreciating these age-related changes becomes imperative in tailoring care strategies for diverse patient demographics. Fundamentals of cardiac assessment techniques for thorough cardiac assessment. Auscultation, palpation. Auscultation, through the discerning ear of a nurse, unveils a symphony of heart sounds, each hinting at potential cardiac aberrations. Coupled with palpation and other assessment techniques, nurses gain insights into cardiac anomalies, facilitating accurate diagnoses. Interpretation and application of cardiac assessment findings. The amalgamation of assessment findings, combined with patient history and other diagnostic tools, forms the bedrock for insightful interpretations. These findings steer the formulation of tailored care plans, ensuring individualized patient-centric care. Practical scenarios highlighting cardiac assessment procedures. The application of theoretical knowledge within practical settings enhances nurses' diagnostic acumen. For simulated scenarios or hands-on experiences, nurses refine their skills in recognizing subtle cardiac abnormalities. Common cardiac diseases and disorders. Heart failure, causes, symptoms, and nursing interventions. Heart failure, a complex interplay of structural and functional impairments, demands holistic care approaches. Nurses armed with detailed insights into its etiology and manifestations can proactively intervene, optimizing patient outcomes. Myocardial infarction, pathophysiology and emergency management. Understanding the catastrophic cascade of events during myocardial infarction allows nurses to act swiftly in emergency situations. Knowledge in recognizing ischemic events and initiating prompt measures is instrumental in preserving cardiac function. Arrhythmias, types, diagnosis, and nursing considerations. Arrhythmias, a manifestation of disrupted electrical impulses in the heart, necessitate meticulous monitoring and tailored interventions. Proficiency in identifying arrhythmic patterns empowers nurses to mitigate potential complications. Valvular heart diseases. Overview and nursing care approaches. Valvular pathologies, altering cardiac hemodynamics, require a nuanced approach in nursing care. Understanding these anomalies assists nurses in implementing specialized care strategies. Hypertension, impact, complications, and management strategies. Hypertension, a pervasive cardiovascular disorder, warrants vigilant management to prevent its systemic ramifications. Nurses adept in managing hypertension play a pivotal role in averting associated complications. Diagnostic procedures and imaging and cardiac care, electrocardiography, ECG/EKG, interpretation and analysis. Proficiency in interpreting ECG/EKG tracings allows nurses to detect various cardiac abnormalities and ischemic events, guiding subsequent diagnostic and therapeutic interventions. Echocardiography, uses, interpretation, and clinical applications. Echocardiography, a cornerstone in cardiac imaging, furnishes real-time insights into cardiac structure and function. Nurses well-versed in interpreting echocardiograms contribute significantly to diagnosis and care planning. Echocardiography, uses, interpretation, and clinical applications. Echocardiography, a cornerstone in cardiac imaging, furnishes real-time insights into cardiac structure and function. Nurses well-versed in interpreting echocardiograms contribute significantly to diagnosis and care planning. Stress testing and cardiac catheterization, indications and nursing role. Understanding the indications and nuances of stress testing and cardiac catheterization equips nurses to assist in these procedures, providing invaluable support during diagnostic interventions. Pharmacology and cardiology. Medications for cardiovascular health. Beta blockers, ACE inhibitors, diuretics. A profound comprehension of cardiovascular medications empowers nurses in administering, monitoring, and educating patients about their therapeutic regimens. Beta blockers, ACE inhibitors, and diuretics, among others, wield varying mechanisms in managing cardiac conditions. Antiarrhythmic drugs, types, actions, and nursing considerations. Antiarrhythmic medications, with their diverse classifications and actions, necessitate vigilant monitoring and a nuanced understanding of their potential side effects. Nurses are pivotal in patient education and monitoring for adverse reactions. Anticoagulants and antiplatelet agents. Utilization and monitoring protocols. The meticulous administration and monitoring of anticoagulants and antiplatelet agents are paramount in preventing thrombotic events. Nurses versed in their utilization ensure patient safety and optimal therapeutic outcomes. Emergency response in cardiology. CPR and basic life support in cardiac emergencies. Proficiency in CPR and basic life support interventions are the cornerstone of emergency response. Nurses well trained in these protocols are crucial in stabilizing patients during cardiac emergencies. Defibrillation. Procedures and nursing interventions in code situations. Understanding defibrillation procedures and the nursing role in code situations ensures swift and effective responses, potentially salvaging lives during critical cardiac events. Simulation scenarios for effective emergency response training. Simulated scenarios provide a platform for nurses to refine their skills in managing high-stress cardiac emergencies, fostering preparedness and confidence in real-life situations. Geriatric cardiology considerations. Addressing cardiac challenges in the elderly population. The elderly demographic presents unique cardiac challenges, requiring tailored care strategies. Nurses well-versed in geriatric cardiology cater to the specific needs of this population. Adaptations and specialized care approaches for geriatric cardiac patients. Adapting care approaches by considering the complexities of age-related cardiac issues enables nurses to provide comprehensive and empathetic care to geriatric patients. Ethical dilemmas and holistic care principles in geriatric cardiology. Navigating ethical complexities and adhering to holistic care principles becomes imperative in providing dignified and holistic care to geriatric cardiac patients. Lifestyle modifications and preventive cardiology. Promotion of heart health. Dietary, exercise, and lifestyle recommendations. Educating patients about lifestyle modifications is fundamental in preventing cardiac ailments. Nurses serving as advocates for heart health empower individuals to adopt healthier lifestyles. Patient education on preventive measures and risk factor management. Empowering patients for education on risk factors and preventive measures fosters active participation in their cardiac health management. Strategies for patient compliance and long-term behavioral changes. Facilitating patient compliance to treatment plans and fostering sustained behavioral changes ensure long-term cardiovascular health. Key cardiac clinical concepts. A concise synthesis of essential cardiac concepts emphasizes their significance in nursing practice and NCLEX preparation. Encouragement and preparation strategies for NCLEX success in cardiology. Strategies aimed at bolstering confidence and readiness for tackling cardiac-related questions in the NCLEX examination. Emphasis on ongoing learning and professional advancement in cardiac nursing, highlighting the importance of continual learning and professional growth in the dynamic landscape of cardiac nursing practice. This revision ensures the entire article is optimized for the specified keyword phrase. If you need any further adjustments or additional sections, feel free to ask. Elevate your nursing career with comprehensive cardiac clinical mastery. Mastering cardiac clinical concepts doesn't just enhance your performance in the NCLEX, it propels your nursing career to new heights. By embracing the intricacies of cardiology and honing your skills in cardiac assessment, emergency response, and preventive cardiology, you become an invaluable asset in any healthcare setting. Unlock career opportunities. Employers seek nurses with a robust grasp of cardiac nursing. Your proficiency in cardiac anatomy, assessment techniques, and medication administration opens doors to specialized roles in cardiac care units, emergency departments, and cardiovascular research. Be a champion in patient care. Your expertise in cardiac diseases, diagnostic procedures, and emergency protocols enables you to deliver unparalleled care. You'll comfort, diagnose, and heal with confidence, positively impacting the lives of cardiac patients at every step. Propel your NCLEX success. The comprehensive understanding gained from delving deep into cardiac clinical concepts significantly boosts your readiness for the NCLEX examination. You'll approach cardiac-related questions with clarity and assurance, securing your success in this crucial test. Join the vanguard of healthcare by mastering cardiac clinical topics. You align yourself with the forefront of nursing excellence. Your dedication to ongoing learning in cardiology positions you as a leader, continually contributing to advancements in cardiac nursing. Embrace the world of cardiac nursing and witness the transformative impact it brings to your career, your patients, and the healthcare landscape.